This is Plant-Based Briefing, The Psychological Toll of Living with Preventable Disease by Nelson Huber-Disla at nutritionstudies.org. And I'm Marian Erickson. This is the Plant-Based Podcast where I curate a variety of articles on plant-based and vegan living, get permission, and read them to you here in about 10 minutes or less every weekday. There are so many reasons to live a vegan lifestyle. Of course, for the animals, but the environment, pandemics, workers' rights, biodiversity loss, wildlife extinction, so many reasons that I curate articles on a variety of these topics and share them with you here. I personally love to keep up on all this information, and obviously some of you do too, so I appreciate you listening. And now let's get to today's Plant-Based Briefing. The Psychological Toll of Living with Preventable Disease by Nelson Huber-Disla at the T. Colin Campbell Center for Nutrition Studies at nutritionstudies.org. Although we all know on some level that the state of health in the U.S. is not in a good place, it can be difficult to quantify exactly what that looks like. There are multiple layers of failure, and some are more immediately apparent than others. The physical challenges of living with disease are the most obvious. The financial repercussions are also widely accepted. Most people know that our healthcare system is overburdened, if not outright broken, and that medical expenses are a top cause of bankruptcy. However, not enough is said about how all of this generally relates to our psychological health. How does it feel to live in a society in which chronic disease is commonplace? Years, if not decades, of accompanying medical interventions, mostly pharmaceutical, are accepted as not only normal, but also inevitable. We seemingly cannot afford to manage these diseases, so much so that they threaten to overwhelm the national economy. Medical expenses are among the most common cause of personal financial crisis, and the profits enjoyed by a small minority are seemingly more protected than the health of the masses. How might these and other realities of health in the U.S. impact our collective psyche, our trust in the systems purporting to address these challenges, and our outlook on the future? How do we cope? Taking a longer, wider view. Before more closely examining the psychological damage inflicted by disease, it may be helpful to consider a few specific examples that illustrate why the current state of health in the U.S. needs to be addressed. In a previous article exploring life expectancy trends, we found that global life expectancy has trended upward and continues to trend upward in the long term because of basic medical advances, accessibility to key resources, and decreasing childhood mortality. However, when we analyze only wealthier countries, where these gains have already been realized to a greater extent, we see that the U.S. lags behind. In the U.S., life expectancy has stagnated or even declined in recent years, while the gap between the U.S. and other wealthier countries was worsened by the COVID-19 pandemic. These trends preceded the pandemic. Life expectancy at birth in the U.S. is more than 3 years shorter than the average of high-income countries. Average healthy life expectancy, or HALE, is more than 4 years shorter within the same group. Whereas 3 or 4 years might not sound like a lot in an individual life, in a population of more than 330 million, this amounts to an astronomical number of lost years of life. Like HALE, the metric years lived with disability gives a more nuanced indication of the overall quality of life, not only length of life. And again, for this metric, the U.S. does not compare favorably with other high-income nations, despite spending the most on healthcare. As cited in the Future of Nutrition, 55% of Americans take prescription drugs, 4 per day on average, and many of these people, as well as many of the minority who do not regularly take prescription drugs, take dietary supplements too. All of this reflects what Dr. Campbell correctly describes as not the successful pursuit of health, but rather the normalcy of disease. Chronic disease and depression, stress, and quality of life. The relationship between chronic disease and depression is strong and bidirectional. People with chronic disease are likelier to be depressed, and depressed individuals are likelier to develop chronic disease. The National Institute of Mental Health of the NIH specifically highlights the link between depression and several of our deadliest, costliest diseases, including heart disease, diabetes, and Alzheimer's disease. For example, patients with rheumatoid arthritis are on average as much as 6 times more likely to suffer from a mood disorder compared to the rest of the population. Unsurprisingly, the same bidirectional relationship exists between disease and stress. What is more interesting is how chronic stress produces macroscopic changes in certain brain waves consisting of volume variations and physical modifications of neural networks. Stress, in other words, transforms the brain. This observation is well supported by various types of evidence, including brain imaging studies and the post-mortem examination of depressed individuals. Chronic disease also affects the psychological well-being of those not directly suffering from the disease, as many caregivers can attest to. Caregivers suffer from high rates of chronic stress and depression, making them susceptible to poor health outcomes themselves. Indeed, as the authors of a 2008 review write, caregiving fits the formula for chronic stress so well that it is used as a model for studying the health effects of chronic stress. Finally, psychological well-being during times of disease is obviously hugely important in determining overall quality of life. In a study of quality of life in heart disease patients who received a left ventricular assist device, researchers found that psychological factors were the strongest predictors of quality of life satisfaction. Poor psychological health is predictive of lower quality of life satisfaction, which in turn could contribute to poor health outcomes and even the progression of disease. This raises a troubling question. If disease, especially chronic disease, is known to undermine psychological health by increasing stress, contributing to depression, and limiting a patient's ability to function, how does one avoid a downward spiral of interconnected physical and psychological suffering? Solutions. Patients can and do adopt many coping strategies supportive of better psychological health, even in the most dire circumstances. Researchers have found that religious or spiritual beliefs and activities help improve coping with terminal illness. This should come as no surprise, and it's also relevant to non-terminal patients suffering from chronic diseases. Likewise, and again not surprisingly, patients with a strong positive relationship with their physician are likelier to report a higher quality of life. This suggests that physicians, not only patients, must be better equipped to deal with the psychological challenges inherent to disease treatment. A study on this subject, published in 1995, concludes clinicians who felt insufficiently trained in communication and management skills had significantly higher levels of distress than those who felt sufficiently trained. If burnout and psychiatric disorder among cancer clinicians are to be reduced, increased resources will be required to lessen overload and to improve training in communication and management skills. I can only hope that these increased resources have been provided to physicians in the intervening decades. Ultimately, however, there's only one way to ensure a complete break from the vicious cycle of chronic disease and psychological distress, and that is to stamp out chronic disease at its roots. Helping people understand that many chronic diseases can be prevented and even possibly reversed is hugely empowering, and this sense of empowerment can reinforce good mental health. How many people fully appreciate nutrition's profound ability to control heart disease, diabetes, Alzheimer's, cancer, and more? How many doctors are properly trained in this healing medicine? How well are we doing to get this message into the mainstream? You just listened to The Psychological Toll of Living with Preventable Disease by Nelson Huber-Disla at nutritionstudies.org. And I'm your host, Marian Erickson. And I can only hope that we are doing better at getting this message out to people, because it really is life-changing. People do have power over their health in many ways, and diet is a huge one. A healthy, whole food, plant-based diet can reverse diseases and prevent diseases. So please share this episode with anyone who might benefit, and thanks for listening.